Good morning, everyone. My name is Wyatt, and today we'll be discussing a fascinating and somewhat controversial question: has our knowledge of neuroscience led to ethical dilemmas? To begin, neuroscience is a branch of science that focuses on the study of the brain and nervous system. Over the past few decades, advances in neuroscience have radically transformed our understanding of the human brain. We now know how the brain controls thought, emotion, behavior, and even memory. We can map the brain, and thanks to modern technologies, we can even look inside it in real time. But with this knowledge comes responsibility and sometimes ethical challenges. Let's consider one of the most powerful developments in neuroscience: neuroimaging. Technologies like MRI and PET scans allow us to visualize brain activity and identify abnormalities. While this is revolutionary for diagnosing conditions like Alzheimer's, schizophrenia, and brain tumors, it also raises questions. For instance, what if brain scans could predict criminal behavior? Would it be ethical to use such scans in legal proceedings? If someone's brain scans show a predisposition for violent behavior, should they be held responsible for actions that they haven't even taken yet? Would such a test lead to discrimination or the violation of civil liberties? These are questions we'll need to consider as technology advances. Another area where neuroscience has raised ethical concerns is neuroenhancement, which is using drugs or brain stimulation to improve cognitive function in healthy individuals. Consider drugs like Adderall or modafinil, which were originally developed for people with attention deficit disorders or sleep problems, but are now used by healthy students and professionals to boost focus or memory. Is it ethical to use such substances to enhance performance? Should we regulate these neuroenhancements to ensure fairness in education and in the workplace? Some argue that it gives an unfair advantage to those who can afford these treatments, farther deepening social inequalities. Genetic manipulation and the potential for designer babies is another ethical controversial area. With advances in genetic testing and even CRISPR technology, we are now able to make genetic modifications in babies, potentially eradicating diseases or disabilities before birth. But this does lead to a challenging question, which is, where should we draw the line? If we can select the traits for intelligence or physical appearance, how far are we willing to go in designing our children? Is it ethical to create children with genetic traits that may push societal norms, or does this practice lead to a future where only certain traits are valued and others are seen as undesirable? Neuroscience has also made it possible for us to treat mental health disorders more effectively, but even in this field, ethical dilemmas arise. New treatments like deep brain stimulation and transcranial magnetic stimulation offer hope for patients with depression or anxiety when other treatments fail. However, these interventions involve altering the brain's chemistry and electrical activity, which leads to questioning the boundaries, where it's like borderline brainwashing. How much is too much when it comes to altering an individual's brain? And should we allow society or doctors to dictate how normal people should feel or think? Finally, let's talk about neuroprivacy. As neuroscience advances, we gain the ability to read and interpret thoughts and memories. This could be incredibly beneficial in terms of diagnosis and therapy. But it also poses a significant threat to personal privacy. What if your thoughts could be accessed without your consent? What happens when the boundaries of the private self are breached? The notion of neuro rights is emerging, where individuals can have legal protection from unwanted access to their brain data, much like the protection of data on your phone. In conclusion, while neuroscience offers remarkable opportunities to improve human life, it also forces us to ask difficult ethical questions. As we continue to unlock the mysteries of the brain, we must remain vigilant about the potential consequences. Our pursuit of knowledge should always be balanced with respect for individual rights, societal fairness, and the preservation of human dignity. Thank you.